Hi, this is Pamela Worth with the Hello Health podcast, and today I have Dr. Stephanie Warner. She has been in healthcare for the past 18 years, and she is now an incredibly passionate naturopathic doctor and classically trained licensed acupuncturist. And she believes in uncovering the root of symptoms and working harmoniously with the body's physiology to achieve sustainable health. So welcome, doctor. Thank you so much for being on.
Hi, Pamela. Thanks so much for having me.
So you started first in Western medicine, is that right? Kind of talk
Yeah.
to us a little bit about how you got into healthcare and kind of your path and led you here to become a naturopathic doctor. But you're not just an ND. You also have this holistic way of taking a look at the entire body and really looking at root cause. So I'll let you kind of start with your journey.
Yeah, of course. Well, I guess what first introduced me to naturopathic medicine, I never heard of it at all up until I was in high school, and my mom started to be unwell. And so, to my delight of ordering more takeout in and certain stuff like that as a teenager, my mom was unfortunately like suffering with intense fatigue. Just simple activities of doing laundry or going up the stairs was really difficult for her. And it wasn't until her friend said, "Well, why don't you go see a naturopathic doctor?" And my mom was like, "What?" And so sure enough, she got a referral and saw a naturopathic doctor. And through this different, unique approach assessment, it was uncovered that she had heavy metals in her teeth, which is actually pretty common amongst individuals, 50 to the age of 70, because that's usually what they did for dental fillings. So meanwhile, before all this happened, she went through a cycle of frequent antibiotic use through conventional medicine. And then it wasn't until, she got her mercury fillings removed that I got my mom back from that. So that was kind of my first introduction to naturopathic medicine. And then sure enough, in high school, probably from all of my bad things that I would eat, I would get stomach aches. And so eventually my mom funneled me to go see him. And I went on a food sensitivity elimination protocol, and conquered some of the symptoms that I was experiencing at the time. So that was my first introduction, and I was really fascinated by it. He had this fancy machine. It's called a Mora machine. It's got this fancy magnetic necklace and these little electrical probes. And he puts them on your fingers and toes. It's a machine from Germany, and acupuncture points. And he would guess things about what was going on with my body. Like, "Oh, do you wake up with a runny nose in the morning?" I was like, "Yes," and I was pretty blown away. I was like, "You're a mind reader. I can't believe this." So anyways, it truly did fascinate me. And I did go forward, considering to work in medicine, in college. And then my grandmother got sick, and I decided to go down the nursing trajectory. Life led me there. And so I became a registered nurse. I first started working in internal medicine. And internal medicine, it's like, if you have three health diagnoses like diabetes, COPD, or, just a lot of health stuff going on 5 to 10 medications kind of deal. You end up there. And so I loved it. I learned a lot about emergency medicine and, just different health and disease processes that I learned in textbooks. But, over time, I kind of felt like I was a hamster in this chaos hamster wheel. It was a very chaotic work environment. And you eventually, the learning curve kind of plateaus, and you kind of see repeat conditions and no discussion of prevention. And I'd look at my day, and sometimes I'd spend a full hour of my workday passing out pills, and I would see, you get this one, oh, you get this side effect, let's throw this one on. And, I just saw this whole thing, and I would see the patients get mac and cheese and tater tots for meals. And I was just like, this just isn't the healing environment that I thought I signed up for. And so what I did was, at that time, I went back to school, and I'm originally from Calgary, Canada. And so at that time I moved to Portland, Oregon, and studied the naturopathic physician program there. And it was a rather intense program to start, long days. And sure enough, as I started this program, I started to get health symptoms, like I guess just feeling tired and headaches and different things. And so I went to my clinic, the naturopathic clinic, and I somehow found my way into doing this group acupuncture shift. It was really inexpensive, and all 10 of us would sit in a room, and we're all faced in a circle, and we'd meet with the student, and the teacher would say, "Okay, do this," and they'd talk about crazy things like water and fire and wood and metal, and I was so confused. But they would, take my pulse, and put needles in, and I'd walk out of there, and the headache, that I was experiencing for like 3 hours would just be gone. And I was like, wow, this is just too good of a thing to pass up on. And so I studied, I have a master's of Chinese medicine as well in herbalism. So that kind of has brought me to where I am. And previously I was practicing in Canada, and I've just recently, in the last couple of years, relocated to Scottsdale, Arizona, which has kind of connected you and I on this path here in Scottsdale.
No, it's super what you're doing. So many questions. When you are working with someone and they are interested in acupuncture, how do you assess sort of how to help treat them, or what does that really mean? And maybe describe some of the energy and how that can help people. And I mean, I meet so many people with migraines and with headaches. I think that's super interesting too.
Gosh, what do I want to say about that? So typically, the way that I kind of run my clinic down here in Arizona is I typically do prefer to meet people in my clinic as a naturopathic appointment first. And it's probably, my RN and ND preference, just to try to understand the labs and different things. But, of course, some people do come in straight for acupuncture, and that's totally fine too. But yeah, so in Chinese medicine, there's there's so many diagnosis platforms. So, we're assessing your skin tone. We're assessing the sound of your voice. I kind of have this singing voice where, it sounds sometimes like I sing a song. Maybe you can think of other people that I was just at a conference over the weekend, and it sounds like this speaker, this physician in this conference is crying, So it's even in the tonality of your voice. It's there's some practitioners out there, I don't do this, but some practitioners do a facial diagnosis. Tongue diagnosis is a common one, and pulse. Actually, even for me, because my teachers would tell me, in school, if you really want to learn acupuncture and you really want to do a good treatment, like, you need to meditate. And I took that challenge pretty seriously. And so for, the couple years in my Chinese medicine program, I started meditating 20 minutes a day. And I feel that kind of opens up some of our sensory organs, and heightens our perception. So since that whole process, I mean, my smell and my taste is extremely heightened. And even sometimes not all the time, but definitely on the person's openness, I'll feel where their energy and stuckness and maybe pathology is when I'm just physically in their presence. So I use all of those keys. But honestly, when I'm in somebody's presence and I feel that within my body, that kind of goes to the top of the list over what's going on with the tongue, because it's like their body is screaming at me like, hey, this is what needs to be addressed here.
So, and you have a good point about lab tests and kind of assessing the person. When someone comes in and meets with you, do you have a particular set of tests that you like to make sure that you run, or certain things that you really want to look at first?
Yeah, great question. So usually what I do is, meet with somebody for about 75 minutes, and we kind of go through that intake process, from head to toe, what's going on with their body, like headaches all the way down to toe pain, what's going on in the interim. But then we also, what's unique and different is we're recognizing different outside influences. I'll hear, oh, well, I have sinus issues, and I have joint pain, and I have extreme fatigue. And then I start to like, okay, there's a couple things things, let me ask about mold exposure in this person's house, or, take in these external environmental factors into the intake, as well as sleep and energy and work. It matters on who you are, and it all influences you. So usually, yeah, I think, the first appointment is that information gathering, and then at the end of the discussion we'll talk about lab tests. So we have like conventional tests that naturopaths orders, DOs, MDs order, MPs, and that's your thyroid test and your vitamin D and your iron and different things like that. So for me, if it's pretty common that many of us are tired, and so we got to look at some of these lab tests. Like we got to look deeper into the thyroid and iron and vitamin D and different things. But then additionally, I will, bring out some of my lab reports, and what they are called functional medicine tests. So these are specialized tests that, individuals like naturopathic doctors or other practitioners that have done additional functional medicine training, look at. And what they do is kind of pick up nuances between, the blood work and just subtle things. Because one thing that's very common that I hear is for example, somebody with that, a woman will just feel tired, go to the family doctor. The family doctor looks at the thyroid, says, "Hey, you're all good. There's no tests that prove why you're tired." And so they often come to me and say, I know something's wrong. I feel tired all the time. I never used to feel this way. My doctor says nothing's wrong. What can I do here? And that's really when the beauty of the functional medicine training and tests come in. One thing in regards to the training for functional medicine is we look at the conventional values a little bit differently. For example, thyroid, we have a different, tighter reference range that we see people feel best at. And then additionally, for the functional testing, there's a lot of different fun tests out there. It just depends on what's affecting this person. One of my personal favorites is called a Dutch hormone test. It's a urinary hormone test. It measures estrogen, testosterone, progesterone, cortisol, but over a course of 24 hours rather than just a one value, which is typical on a blood test. It looks at gut health and inflammation, melatonin, B vitamins, a whole bunch of different pieces of information. So I do love that test. I do work with that one a lot. But yeah, food sensitivity tests. What other popular ones? There's a lot of gut health based tests. So yeah.
And when you're, and then back to the herbalism for a second, when do you decide when to introduce herbs and when not to use them? And I think that's new for a lot of people. And how is that different than like supplementation, or is it similar?
Good question. So yes, I mean, all of us practitioners are different. But the way that yeah, so supplements obviously, are the micronutrients, but even some people might even say, herbs are included in supplements. And of course, we have Western herbs and we have Eastern herbs. We have like Southeastern herbs. So of course, we have like Ayurvedic medicine from India that, sometimes like I personally have a high blood pressure supplement that's an all Ayurvedic herbs. And then I use a lot of Chinese herbalism. That was kind of my heart and passion. I feel like you really feel the effects when you take Chinese herbs. And that's why I love them. Like, because many of us, I'm sure, have taken a multivitamin and you take it and you don't necessarily feel a huge shift. Right. And so for me, that's why I truly love like some of the herbs and stuff, because you can feel a little bit more of a shift. But overall, I mean, I think all different types of supplements are important. And, one common question I get asked is, like I should be able to, get everything I need through my food and, feel good. But, when one issue that's kind of happening now to many of us is our food quality has, deteriorated. Our soils have deteriorated. And then of course there's a lot of chemicals in our food and different things that are kind of disrupting our ability to absorb nutrients. So part of that conversation with people is, do you want to live your life at energy at a 3 out of 10 or functionality at a 3 out of 10, when if you just take a couple things, your energy and life might change, to an 8 out of 10 or 9 out of 10, So I think, yeah, getting these things addressed and looking at it helps with energy and, just brings you back if you've been kind of suffering with something.
Now, what are some of the other treatments that you do? I know that you see a variety of people that help with detox, with getting to the root of some really hard health challenges that people have.
Yeah, the most interesting thing about my relocation here in Arizona is that it seems so many individuals, even though we're in the middle of a desert and there's not much rain, there's so many individuals impacted by mold in their home. And I presume there's sprinkler leaks, we have skylights, we have HVAC systems. So I'm really truly surprised by a lot of individuals that have mold in their living situation. So that's a key component. Additionally, I meet a lot of women. I work with a lot of women, and I work with hormone optimization, testing their hormones, and potentially, many women are, having hot flashes or menopausal weight gain or sleep issues. Those are kind of big components. And often in those cases, I'll use the Dutch hormone test to kind of help understand whether it's a cortisol relationship or a low estrogen progesterone type relationship. And then, of course, other therapies that I do offer is I've just recently in the last year got into exosomes and stem cells. So I've just completed some additional training, and actually last January I was all excited to do PRP facials, and then I stumbled across the exosome world, and I never fully launched PRP, that vampire facials, in my business because I just got so passionate about these exosomes, these nano stem cells that have a profound ability to restore cellular function and collagen. And another thing that I've been doing is there's exosomes to restore hair growth. So I've been growing more hair with clients. Additionally, the stem cells right now, I'm currently just working with them for orthopedic injections and joint injections or sore joints. But I'm hoping in the next couple months to kind of launch IV stem cells, which can benefit people with autism, MS, ALS, and those kind of things. So exciting time to be in medicine.
It really is. So I would imagine many people don't know what exosomes are. Can you speak to that versus stem cells and how they're similar or different?
Yeah. Well, okay. So it's a broad definition with stem cells. So, there is autologous stem cells, which come from yourself. So, you'll either have donate yourself. They'll drill a hole into your bone and take out the stem cells from your bone marrow and then re-inject those back to you. The ones that I use are actually from the umbilical cord of the placenta. So mom has baby in the hospital, the providers say, would you like to donate your placenta or do you want to keep it? And often women say, I'll donate it. And what they do is they bring it down to the lab and they harvest out the stem cells or Warden's jelly that's in the umbilical cords, and then they sell it to us providers. And what we do with it is orthopedic injections. So they're just larger cells, they're neutral cells, and so they can become cartilage, they can become bone, they can become muscle, different things like that, and restore circulation. Additionally, exosomes are included with or derived from the stem cell, but they're almost nano stem cells. They're very micro and tiny. So they contain a lot of different growth factors and just very different tiny signaling molecules that just is a little bit different. And so the exosomes that I use, there's 3 different lines that I'm currently using. And so they're all 3 different type products. So one of them is for, skin restoration and collagen and wrinkle prevention and anti-aging. The second one, they've kind of manipulated the exosomes or focused on getting the growth factors for growing hair and stopping hair loss. And then the third is for pigmentation issues. So if anybody has melasma, rosacea, sunspots, or even acne, there's a third product that they've kind of designed to kind of change that. Does that make sense?
Yeah, no, that's super. And my mom has done the growth factors after she had chemotherapy, and it helped her so much. She's got hair again, and she feels great. She feels pretty, and I believe that you've worked with quite a few men with that as well, and you've seen some pretty incredible results.
Yeah, exactly. Did your mother do like IV exosomes, or did she do like for like the hair restoration component?
Restoration, where it's almost like the microneedling on your scalp, and then they put the
Yeah.
yeah.
Yeah, exactly. Yeah, that's exactly what I do. But yeah, I'm having really cool and exciting results, like young women with, alopecia just in spots and, are so uncomfortable with their hair growth that they're wearing wigs, and, to the ability to like grow that hair back is kind of very rewarding. And of course, another observation that the exosome company didn't even tell me about, but I've been observing in my patients, is that some of the hair, especially, the older gentlemen that might be white hair, some of it's growing back dark gray. So I feel like that's a new potential component as well to kind of change some of our hairs back to our normal color.
Okay. Yeah. I've had people ask me this because and it's wonderful that this is now available in the States, because I had to take my mom down to Mexico for her initial treatments. And when you're buying these, I think a lot of people get concerned, like, where did it come from? And is it US based, or did it come from, Panama, Costa Rica, Mexico, Colombia? There's a lot of places where this is being done. Can you speak a little bit about to the company that you're working with and how it's safe here in the U.S.?
Yeah, great question. I think that a lot of there are some stem cell centers in Mexico or South America that are that do have labs and are replicating, the original cells that I referred to, from the umbilical cord. So there are labs like more internationally doing this replication process and targeting. However, it's a delicate balance. It helps the clinics like save a little bit of money if they're able to have this lab and do it. Unfortunately, it's not broad spectrum approved to do that kind of thing here. The Food and Drug Administration has been very strict in regards to labs and different things in that regard. So most of us providers here in the U.S. right now, many of us don't have labs. Kind of thing. And I think that that's one of the key differences. And I do see that, it's all about reputation. The leading clinic in Panama, there's people lined up out the door for that therapy. And it's just, they have a good reputation. I think here in America, people are kind of slowly getting used to what it looks like here, just because I think that we need to continue to work to dispel this negative stereotype that's kind of gone on. And, because I think that's definitely a component to the narrative that, if you want the best, you've got to go international. But it actually turns out that the gentleman that started the most successful clinic in Panama, he's actually local. He's locally here from Scottsdale, Arizona. So, so.
Yeah, it's amazing. Can you speak to the difference? So, and a friend of mine had asked me this, because with one of my kiddos who's a competitive athlete, I had taken him to a doctor that would give him a stem cell injection in one of his joints because he had a small tear.
Mhm.
And it healed so much faster than doing PRP.
Mhm.
But in her mind, it was exactly the same. But I don't believe it is, but I can't technically speak to that. Could you share a little bit of the difference between like a PRP shot versus a stem cell shot in an orthopedic joint if you've got an injury?
Yeah, great question. Great question. Yes, PRP. So it stands for platelet-rich plasma, and basically how we collect it. It's kind of free. We got to do the tube and have the centrifuge, but so what we do is capture some blood from the person that's going to get the injection. We spin it out, and when we put the blood in a centrifuge, there's like a honey coating kind of at the top at the spin, and so that's the plasma, that's the jelly, that's kind of a component of the blood, and that's what we're injecting into the joint. And then again, the difference with stem cells is these are, well, the ones that I use are from the umbilical cord of the placenta, so there is a difference. In my opinion, I think that PRP, it's interesting that you mentioned your son had a different response from the PRP compared to the stem cells. Because I think individuals under the age of 30 do better with not necessarily do best with PRP injections, but they do significantly better than individuals over the age of 30. It's can be an actual painful injection, and the PRP, if you are slightly inflamed, if you have diabetes or a health hypothyroidism, if you have a health condition where there's inflammation in your body, you're basically re-injecting the inflammation back in to the joint or component of your body. With stem cells, they are largely anti-inflammatory. So in my opinion, I think a lot of people are leaning into these different types of orthopedic injections because they are more inflammatory. But that being said, if somebody does have inflammation, maybe diabetes, maybe overweight, there's sometimes not a perfect match in the moment to get stem cells because the full benefit is going to be reduced just because of the inflammation. So just mindful of that.
Yeah. When you're thinking about helping people kind of clean up their act, if you will, in terms of like eating or things they could or should be doing, reducing overall chronic symptoms, and a lot of it, I think, comes down to food and lifestyle. Are there
Mhm.
any things that you particularly want to share with them or encourage them, or what do you kind of like to focus on when it comes to food?
Yeah, gosh, that's the $1 million question. There's diets in and out and all of this. I would say, I mean, depending on the person, if somebody does have a lot of digestive issues, that brings me to my functional test. One of my favorite things sometimes to do is a food sensitivity test. If somebody's, has never made a diet change, and it's crazy what we'll find in there. And I think what's beautiful and unique about that is it's kind of puts together a diet unique for the person that we meet. And I've had a 6-year-old with stomach aches or headaches, and it turned out he had a food sensitivity to peanuts. And so we pulled the peanuts out and he was doing great, So it could be funny things that you just don't think of. So that's one example of a circumstance where, we can be really accurate and all of this. Of course, I'm a big component of organic fruits and vegetables and eating and grass fed and different things like that. But of course, that we have like the Dirty Dozen and Clean 10. If somebody's heard of that, or if they haven't heard of that, they can look into that. So for example, if you're where you are, you don't have access to a lot of organic options, or maybe the organic option is much more expensive, potentially buying something like a banana that has a peel on it compared to something like a grape, which is really porous and holds on to some of the chemicals that are used in our food production. So that's one thing. And then, of course, for individuals that are struggling with maybe like being overweight or having diabetes or different things like that, I do think that, leaning more towards like a paleo focused diet can be really helpful for people, like low carbohydrates and different things like that. So, and I mean, that's kind of how I personally eat as well. Mm-hmm.
Awesome. Is there anything else that I haven't asked you about that you want to share? How do people find out more about you, your work?
Yeah. So my website is www.elixir, ELIXIR, and wellness.com. And then I'm on Instagram at Elixir and Wellness. And then I'm on Facebook as Elixir Plus Wellness. So that's kind of the key details there. If people are interested and want to learn more, I appreciate you having me on here, and I'm excited that I got to, ramble about my passion of natural medicine. And I mean, I think our body has a beautiful ability to heal itself. So thanks so much.
Thank you, doctor. It's great having you on.
Thanks so much, Pamela.